Natural forces within us are the true healers of disease. Hippocrates. Research by Petrovska found the oldest evidence of documented use of plants for medicinal purposes dates back 5,000 years. The discovery was found on a Sumerian clay slab from Nagpur, consisting of 12 recipes for drug preparation using over 250 plants. Plants were the only source of medicines before 500 BC, when the age of Hippocrates, known as the father of medicine, would redefine sickness as part of the human condition and not a result of some supernatural occurrence. The Bible makes several references to the use of plants as medicine. Here are 5 medicinal plants that are specifically referenced in the Bible. Fig, nard, hyssop, balm of Gilead, and mandrake. The Chinese would be the first to discover that plants were able to heal because of the interactive properties inside of them. This discovery was the catalyst of the expansion of pharmacology throughout the Eastern Hemisphere, with strong influences on Europe, Africa, and eventually America. It would not be until the 19th century where remedies that had sustained people for centuries would be dismissed as superstitious and be replaced by modern Western medicine and big pharma. As we enter the 20th century, man and science are once again revisiting the role of alternative remedies and therapies to combat illness. Today we will look at the role that alternative medicine plays in the continuum of care as we unlock the mysteries that have challenged society for thousands of years.
Hi, everyone. This is Dr. Michelle of Tabernacle Talks, and I have been just so excited and just having so much anticipation about having Dr. Patricia Washington with us today. Well, I want to welcome you to Tabernacle Talks, and our subject today is alternative medicine. And I know that there are many people in our audience that probably are not familiar and they're scratching their heads thinking, what is this? So can you share for people what your formal education and training is, including where you study? Because I think it is just, your journey has been absolutely fascinating.
Well, my undergrad was done at Ohio State, but I was on like a whole different path. And it wasn't until I moved to Chicago that, I got ill, and my only alternative to my illness was pain meds. So a friend of mine was like, hey, why don't you get acupuncture? I'm like, no, I'm needlephobic. I can't take it. I don't want to do it. It took her maybe 2 months to convince me to go. And I did. And after that, I started getting curious to how come it fixed me in 24 hours. No more pain, no nothing. It didn't come back after a week. I kept thinking it's going to come back. It's going to come back. It's going to come back. But it didn't. And so I started researching it. And I read this book called The Web That Has No Weaver. And the web is the meridians that are inside of the body. And the weaver is God, right? The creator weaved what is in our bodies in the acupuncture points that are corresponding with 65 days of the year, as well as the constellations and as well as the seasons. So I took that book and I said, wow, it's a really spiritual medicine. And I said, I think this is a path I should be on. So I entered the master's program at Pacific College of Oriental Medicine. So after the master's training, I went on to get my doctorate. That was another 2.5 years, plus a residency in the United States. And the only places you can do a residency are California, New York, Florida, and Virginia in the hospitals. And that's for pathological as well as pain management. So we were alongside MDs, kind of telling them how our medicine was, and so they would get an understanding moving forward. And then I did a year residency in China So I did 6 months and 6 months, one on the north end of China, one on the southern end of China. So I kind of got to see the differences of how they employ their medicine in two different regions of China. And then got my doctorate. So my doctorate is the terminal degree, which is Doctor of Acupuncture and Oriental Medicine, which means I do both the acupuncture and the herbs. But if you're doing a DAOM, you have to have research. So it's like it's a PhD / OMD. It's crazy.
A doctor's doctor. You're
So
a
I had
doctor's
to do
doctor.
a dissertation as well as a residency. So
Gosh.
that was all crazy all at the same time, but it was very fruitful.
Okay, so that people understand, you hold a research doctorate, not an MD, but it is a practice area where you are able to go into the hospitals because of the level of specialization. So you have the highest credential to perform acupuncture.
All righty, then we can move on. But I do want to tell you that I am kind of shocked by this stat. About 40% of people have used some form of alternative or complementary medicine. Why?
Because people are disenfranchised with Western medicine. And imagine yourself on lisinopril for the rest of your life. And this is not something you want to do. So you're going to go think outside of the box and say, how can I get my health on track without taking medications? Like somebody who's on hypertension might have 4 or 5 pills. Then you've got the diabetic pills that come in with it. Now you're taking 8 pills. So it's like people are coming to us because they want to not be on medications or lessen their medications or find an alternative way to deal with their pathologies without taking medications for the rest of their life. That's why it's increasing. Because we see that all the time. It's like, I want to get off of lisinopril. What do I do? I don't want to be a diabetic anymore. What do I do? You know, so we're getting these people. Functional medicine is increasing as well. I don't know if you've ever heard of functional medicine.
No, I haven't. If you could explain that.
Functional medicine is plant-based formulas, kind of like acupuncture and herbal medicine, but they use supplements and plant-based pharmaceuticals to heal the body, opposed to the synthetic pharmaceuticals that Western medicine employs. So that's why you're seeing this influx and change. And, you know, they say the more we become awakened in what's going on in the world, you have the ability to take control of your health and decide what path you want to go on, opposed to this is how it is, this is how it's always been, so this is how we're going to do it, opposed to something else. Did that make sense?
Now you studied in China, and you studied old traditional Chinese medicine. I mean, that's what you did. Can you compare and contrast for me the differences between Western medicine, Eastern medicine, and why that fascinated you to go to China?
Well, the difference is Western medicine looks at the human body as a mechanical device. This broke, we're going to fix this. But when we fix this, we know because of the synthesizing of the drugs that your kidney is going to be affected or your liver is going to be affected. And once that breaks down, now we'll just add on to it. Opposed to Eastern medicine, or I call it Oriental medicine because it really transcends China, but it looks at the person as a whole system. So we are treating the pathology, but we're also getting to the root. So we treat the root so that the pathology can disappear. Then we treat the mind, because your mind is affected when your body is not optimal, because you're worrying or you're fearful, or all these things are playing into it. So we treat the mind, the body, and the spirit, because all 3 of those things play a part in your health. Opposed to, okay, you're getting ready to go into surgery, you're scared, you're fearful, they're about to take your gallbladder out. You're not really getting an explanation. You're not really getting talked to, so your fear level is higher. Now your blood pressure is higher before you go into surgery. Now they have to lower your blood pressure before you get into surgery, and they're not saying, well, this person's fearful, maybe we should, talk to them, calm them down, help them facilitate being calm before you go into surgery, because when you do that, then your surgical outcomes are better when that person's calm and they're in a better state. So we take all that into consideration when we treat a patient. And sometimes, like before I got into this medicine, like I would go to the doctor, just a regular checkup. And I'm sitting in the lobby for 45 minutes. Now I'm getting mad, right? So now you're getting upset. My time is valuable, just like yours. Then you get back in the back, and now you sit for 15 more minutes after they take your weight and your vitals. Now you're sitting for 15 more minutes, and you've got somewhere to go. And then the doctor comes in. He may talk to you for 2 minutes, 5 minutes, hand you a prescription, tell you to fill it, and you're out the door. Okay, and typically with any patient that comes to see me, your first treatment is going to be an hour and a half, because we go over everything. Your bowel movements, the color of your urine, your daily activities. We even go into environmental toxins, like, do you live near power lines? How far are you from a gas station? How far are you from a factory? Because all these environmental toxins also play into your health, as well as what you're eating. So I always say, if you see a seedless watermelon or a seedless grape, it's not real. Don't eat it. It's created in a lab. A seed has to be goddess seed, right?
Yeah.
So when you see these things in the grocery store, people are blissfully unaware. It's like, oh, I don't have to have seeds in my watermelon, but those are pivotal to it being a real fruit or not a real fruit. So there's an education that we also have with our patients.
Wow. How people are taking notes. Okay, I'm going to read this verbatim, because when we were talking, you said to me, plants, rocks, fossils, leaves, sand, feathers, bark, dirt, jellyfish, and shark fin are naturally occurring things that can be used to expand our ability to heal, but still we perish because of a lack of knowledge.
Okay, so in the Bible, when the Jews wanted a king, God was like, okay, you want a king? I'm gonna give you a king. But you didn't think about the consequences that went along with that. Also in the Bible, it talks about what food in the Old Testament we should be eating. No two-hoofed animals, just different animals that God did not want us to eat. But since you wanted to eat like the Gentiles, you can eat like the Gentiles, but there will be consequences. And even if you go back to the Daniel diet, and Daniel proved that the food that they were eating was so much better and so much healthier than what the king and his armies were eating, some of the biblical principles of how we're supposed to be eating and how we're supposed to be living, we have lost our way. And as a result, we are suffering the consequences of our own decisions.
Wow. So you are what
Does that make sense?
Is absolutely truthful. You become what you eat.
And then the other is the environmental factor as well, because they're putting Whole Food and Trader Joe's and some of these stores that have more organic foods or better quality of meats in other neighborhoods. And we end up having Walmart or Target or Aldi's, some of the lower level food choices. So I tell a lot of patients that don't have those in their area, go out to some other area and go to Whole Food, go to Trader Joe's, go to some of these Sprouts that, the food is better, or go to a farm or where it's a mom and pop farmer who doesn't use a lot of pesticides on their food, and start to try to begin to eat healthy little by little by little. And breathing is a large part of that too.
Now you perform acupuncture, and
Yes.
We're going to show a picture just so people can see what that actually is. but can you talk to us about what's the functional purpose of acupuncture? Like, why would I come to an acupuncturist?
So acupuncture treats everything that Western medicine treats. So, when you typically think, oh, I'm going to my doctor for attention, when we can treat it and help you to reverse it by lifestyle changes. And once you become a partner with a patient, a hurdle for them to start eating better slowly, little by little, because you're kind of coaching them a little bit along the way. And you say, okay, where did you fall off this week? How can we improve you moving into the next week or the next week or the next week? So from that perspective, that's a perspective where you're always talking to your patient. But the needles in and of themselves, just the needle, medicine in them, because somebody could come in with sciatica, I treat them, and they might have had chronic sciatica for 3 years, and they get up off the table and they're like, what happened to my sciatica? It's gone. And I did steroids, I did the cortisone shot, I did all these things, and they became worse because why? Because they just cut off the pain receptors, but it's still there. So acupuncture helps to open up the nerve and get the impingement removed so that they don't have sciatica anymore. It's as simple as that. So I tell patients after they've had sciatica and they're better, give yourself 3 or 4 days. Don't do any heavy exercise. Don't do anything that's going to put you back in that situation. It could be as simple as changing a mattress that you've been sleeping on for 18 years. So we try to give them lifestyle changes that move them in a pattern of being self-healed. And the needles go all the way down to the molecular level where the protons and neutrons are jumping off, and all the needles are doing is helping the body to bring itself back to a point of balance, or what we call homeostasis. So that's really all the needles do.
That's all they do.
Mm-hmm.
Wow. Okay, you also perform a procedure called cupping, and I think we have a picture of that we'll show everyone as well. Can you detail what that procedure does?
Okay, so cupping deals with asthma. It can be used to treat asthma. So you would put the cups on the upper back of the body and the front, and it opens up their bronchial airways so that they can breathe. And the longer you do it, so say you did it for a week, and you'll be asthma-free for 3 weeks. And you're like, I feel it coming back. And then you'd have a cupping again, and it'll last longer. And then you have cupping again. It's acupuncture, cupping, and herbs aren't meant for you to take forever. It's meant for your body to adjust and make those adjustments on their own. So you might have it for maybe 3 weeks, and then you're like, oh, I've been asthma-free for a month. I need to go get a maintenance just to keep my airways open. So it's for that. It's for musculoskeletal issues, shoulder pain, frozen shoulder, lower back pain, sciatica, IT band issues, just anything musculoskeletal you can think of, it helps with as well.
Now, you sent some photos because you've actually developed some lotions and creams to help deal with certain skin disorders, connections. And on this one picture that we're looking at, you actually can see where someone had extreme eczema on their back. And within 24 hours, because of a skin treatment that you prepared specific to that person,
yes,
you can see the difference.
And the interesting thing about that ointment is the 2 pivotal herbs that are in that formula are frankincense and myrrh. And, like when I was, in Bible school and learning like, oh, the wise men brought frankincense and myrrh, as a gift, to mother, Jesus' mother. And you're like, what is up with the frankincense and myrrh? And throughout the Bible, you would see this frankincense and myrrh being, thrown around. And when I got into the medicine, it heals the flesh of the skin, both frankincense and myrrh. And you can actually ingest both of those, frankincense and myrrh. But that's why they used it to embalm bodies. because it would nicely preserve the flesh of the body. So, when I'm looking at herbs and I'm looking at biblical correlations, now I understand why frankincense and myrrh were the most, sought after ingredients in the Bible. But that's why.
Now, you have been a medical missionary as well.
Mm-hmm.
Went to Sierra Leone, and hopefully we're sharing some of those photos so that you can see. Do you mind discussing that experience with us? Why you went, what you saw, and how you were able to help them with your alternative therapies?
It was interesting because we went to, it was 3 villages, and this doctor from Chicago, that was his home area, but they didn't have any hospitals there. We had to literally drive 16 hours to get to the rural areas. And he built this hospital there to service those people, because by the time they could get these people to Freetown, which was like the closest town, they would either be dead or there was nothing that medically anyone can do for them. So in this rural area, not even having access to medications that were current before they expired, they didn't even have that there. Most of their medications were expired. But in treating people with, I treated a little girl that had vertigo. She had it so bad that she would throw up. And her mother brought her to me, and she's like, this is what my daughter's going through. I don't know what to do. And so she and that child ended up staying in the hospital for 3 days. And I treated her with just acupuncture for those 3 days. And she didn't have any more nausea and vomiting. Her vertigo had settled down, and she was able to go home. And her mother brought me back a goat. And I'm like, what am I supposed to do with this? Because she couldn't believe that something could do that. And they didn't have the medications to deal with the vertigo at that time. So I dealt with a lot of things that were abnormal, but with a lot of results, because there was no mental barriers. It was just like, I just need help. Just whatever you can do for me is whatever you can do for me. So you have some people that would say, okay, well, acupuncture is kind of like placebo. It worked because they wanted it to work, or something like that. And I was like, this medicine has been around for millennia, and just trying it once will just change the way people think about medicine. And I feel like in 10 years, now that we're getting implemented into hospitals, it will be like California. So we're considered primary care physicians in California and New York and Florida, so we can order lab tests and all that. But I feel like, the train has moved out the gate, and it's going to be more common to think of acupuncture. And that's why it's being taught at medical schools now, because you want to give your patient, you want to feel like you're giving your patients, let's say it takes a village to raise a child. It really does take a village of different practitioners to, help a patient get to a better place in their life. And as long as, practitioners, whether it's Western or Eastern or even Indian or shamanistic medicine, I mean, there's a place for everyone. But I feel like, once I got into this medicine, I still get some doctors that will poo-poo it and say, oh my God, it's just placebo, it's whatever. So that's kind of disheartening, but it's kind of just sifting through that and putting our differences aside and saying, hey, let's work together. Let's get these patients well. And it's not about the money. You know what I mean?
It's about treating people, treating the whole person.
Right.
You are on the faculty at Morehouse, and
Yes.
you're teaching 3rd and 4th year medical students about the value of acupuncture. Talk to us about how they're receiving that. They're in medical school, and you now have someone saying, we're going to start talking to you about other therapies that have been very evidence-based and that they work. What kind of reception are you getting?
It's a lot of them say, why didn't we have this in our first and second year? Because maybe I would have made a different choice about the direction I wanted to go with their medicine. So I had an example is I had a patient, she had gastrointestinal issues for 5 years, 5 years or 2 years, I can't remember, but they ruled out IBS, Crohn's, diverticulitis. They could not find anything wrong with her. So they called it idiopathic. She ended up being a referral patient of mine. And I ended up finding out just in the conversation, because like I said, we talked to him for an hour and a half, we go through everything. And I couldn't find out I couldn't wrap my brain around what was going on with her. But I asked her, I said, okay, take me back 5 years or 3 years or when it was. I said, was there anything traumatic or life-changing that happened? And she said, I aborted my baby to keep my job. And she just broke down crying.
Wow.
And I said to her, I can make the pain in your stomach go away today, but it's going to come back because you have to deal with the unforgiveness that you feel from doing something you really didn't want to do. So you're carrying that, and it turned into a gastrointestinal issue because you didn't know where to channel that unforgiveness. So I told her, you can go to a pastor, a counselor, but you need someone to help you facilitate getting rid of that unforgiveness that you're experiencing. And she came back 2 months later and told me if I had not said anything, she would still be in pain and would not know what was going on. So she ended up finding a counselor to help her facilitate that unforgiveness. So it could be emotional things that turn into physical things that no doctor can really see.
Now, I do have a question, because, in the United States, we had a lot of problems with opiates. Opioids being, of course, prescribed for medications at a time when years ago, you never received opiates unless you were in cancer treatment and those kind of things. And just, little dentists were giving out opiates. Everybody's giving out opiates. Did you ever find that was an issue in Oriental medicine where they got involved with opiates for pain to the degree that we did in the United States?
No, because in China, acupuncture is your pain relief. And now you have hospitals that are using acupuncture in pain management, the pain management department, to kind of quell the opioid crisis. So my specialty when I went to China was going to be acupuncture anesthesiology for labor and delivery. But America would not allow me to do it because they wanted me to be an anesthesiologist, where if you're in China, you are the anesthesiologist. So I did C-sections and regular vaginal births just using acupuncture needles to kill their pain. So if you can imagine someone being cut open via C-section with just acupuncture as the thing that anesthetized them, they felt no pain. They do open heart surgeries, laparoscopic surgery, you name it. Acupuncture is the only thing that they use to anesthetize the person in China and India.
Wow.
So there's a video that's called Acupuncture Anesthesia. And if you look that up on YouTube, you'll see a guy from Sri Lanka doing a C-section on a woman with just using acupuncture as a tool to anesthetize. So I kind of, show those videos to my medical students as well. And they're like, are you kidding me? Like, why doesn't America talk about it? In order to talk about it, you'd have to talk about the deficiencies in both acupuncture and Western medicine. And does the AMA really want those deficiencies to be talked about? Do you know what I mean?
Wow. That's the first time I've ever heard that. So I'm definitely going to look at that video. I have no idea.
I'm gonna have to pull it up.
That would happen.
Even people with being in America is so sad to me now, because when I also had the opportunity to work in the stroke ward in China, and 14 days with someone with hemiplegia, aphasia, left or right, doesn't matter. 14 days, they're walking out the door, no cane, no walker, they can talk, they can drive, they can get on their scooter, they can go to do Tai Chi, they can do in 14 days.
Wow.
With severe, we're talking about can't move your arm, can't move your leg, can't talk. You're out of there in 14 days. And you're like, what is going on in America that these protocols aren't picked up? And we can get these people restored, opposed to, we're going to send you to occupational therapy. You're going to be there till your insurance runs out. You can put your shirt on, you good. You can brush your teeth. You might have to wear a walker, use a walker for the rest of your life or something like that, but it's not meant to hear the physical therapy and the way that they treat people with strokes is disheartening. Even in the US Virgin Islands, we're trying to put a clinic out there now. And I did a project out there on people with mental health issues, with schizophrenia or bipolar disorder. You actually don't think of acupuncture for the use of that, but it actually works very well to auto-correct the brain from misfiring from certain diseases like bipolar schizophrenia. So there, I literally had to go there and help the doctors that had PTSD before I could help the patients, because they're like, we're burnt out, we're stressed out, we have problems, we need help, you know? So that was another project that just for people with mental disorders.
Now, if somebody's watching and they think, oh, I'm going to just stop taking my medication because I just saw
don't do that.
Dr. Pat, what would you tell them?
That's going to say no. That's going to say no. So you would, like, how we do it is, if you want to get off your medication, you say, I don't want to be on lisinopril anymore. You're coming to me, it's like, give me something. I'm like, look, give me your doctor's info. I want to cooperate, because it's going to have to be a cooperation between him and I to, okay, we're going to put you on this supplement, this herb, but you're still going to have to be on this herb, and then slowly lower that herb and slowly lower the pharmaceutical and get you more on the herb. Or let's see what we can do, but I need to cooperate with your physician, because you may not be telling me everything. So I need to, an assessment from that doctor as to, here's everything that's going on. Here's, what we can do together. Or that doctor may say, I'm adamantly opposed to this person doing acupuncture and herbal medicine. I don't think it's good for them. Then it's left in the patient's hands, but it's never, it's never stop your medications, we got you covered. Never that.
I'm going to give you the last word. If someone is out there and they're just amazed by everything that you talked about today, what advice would you give them if, say, they're suffering from chronic pain or depression? What would you tell them?
The first thing I would tell them is to do a self-assessment. You can, download these self-assessments for like if it's mental health, like, are you depressed? Like, here's an assessment and see if you're depressed. Now, if you are depressed and you're taking medication like Paxil or Prozac, and you're like, I don't want to do that anymore. Well, then let's talk about it. You can come to me. We can use acupuncture. You can use sound therapy. You can use water therapy. These are things that you can do for self-care. And there's a hertz, 432 hertz. You can pull it up on YouTube, and it's a musical tone that helps people self-heal. Now, after you've gotten some form of self-healing, now you can come in, we can evaluate you, go into alternative medicine, and get a cooperation between your doctor, your PCP, and that acupuncturist, so that you can have the optimal best health that you can have. And that takes more than one person to do that.
Wow. Pat, your information has been amazing. I think that it's been eye-opening for me.
Well, I
And
hope you can
sure-
just get the
and I'm sure it's going to be eye-opening for a lot of people. You are helping a lot of people. And I think
sure.
bringing this information to the world is so important so that people know that they do have options, and that, it shouldn't, when we use the term alternative, it certainly sounds in many cases that it can be complementary to the traditional medicine that they're using every day. And I just want to thank you for coming on Tabernacle Talks and just opening our eyes to something that I'm sure we just don't hear about. And I'm certainly going to watch that C-section with that.
Definitely watch that.
I'm going to put that link. I'm going to post that link too, so that other people can watch that too.
So I'm going to send that to you, and I'm going to send you one for speedy stroke recovery.
Okay.
So I want you to watch both of those. The speedy stroke recovery is about 30 minutes, but it's well worth it. You won't be able to stop watching it.
Okay.
And the
that
other
for everyone.
Right. They're like, oh my gosh, if I knew that I could do this with this, I'd have been done it, or the kids with cerebral palsy or pediatrics is like, for me, people kind of brush over pediatrics and what acupuncture can do for pediatric patients, but just because there are needles involved, like with babies and young children, we don't leave the needles in. We'll put the needle in and take the needle out, and they really don't feel it. The needles are painless. They're about the size of one hair on your head. That's it. So it's pain-free. So I tell everyone to try it once and see if that changes the way you think about medicine.
Thank you so much, Dr. Patricia Washington.
Thank you, Dr. Michelle Mobley. All right.
Science shows that plant-rich diets have preventative capabilities, from killing cancer to fighting other degenerative diseases, which ultimately facilitates living longer. Meditation is also an alternative therapy found to be effective in addressing stress and anxiety. The goal of most alternative therapies is to align the body, spirit, and soul to restore the body's natural balance. Today, 78% of mainstream medical schools are teaching alternative medicine because they've determined the beneficial effects of providing evidence-based solutions to their patients to restore their health. And finally, the world market demand for traditional Chinese medicine is estimated at over $23 billion, with most of that growth coming from Europe and the United States.